Our world is industrial. More good is coming out of our interaction with machines than history predicted. We are now able to monitor the abstract, interactions between humans, and migration habits like daily congestion of zones important to our connection. As the COVID-19 shut down economies across the world, factories and labs across Africa have come alive. For many industrial hubs and processing zones across Africa, employees are essential to the revival of the economy. But they have to keep healthy and free from contamination. To help monitor and prevent congestion-related contamination, PanaBIOS, the Pan-African Biosurveillance System, keeps track of congested areas and compliance with conditions necessary to keep Africa COVID-19 free. This technology is powered through an app. Institutions download and key in data from those tested to relevant authorities for monitoring and containing any infections.
When that is done, we have our worksheets, so we have to come back and analyze and then determine who is positive and who is not positive.
Yes.
So once the results have been entered, they can enter the system and know the results of what their locality.
Their locality.
Yeah, and do the follow-up.
How do you also keep data for all those that have been tested, old records?
Okay, so we have an archive.
Okay.
One, the data is electronic machine, so it's stored.
Yeah.
It's between that you're going to start from 15365.
Right. Okay. So that means they are the real numbers of samples that you have sorted.
Yeah.
Oh, okay. That's a lot.
PanaBIOS offers a transition from manual processes and record keeping as a smooth digital experience.
So now when I come here, at least it has entered over here to tell me where the sample was coming from. So if you go to this dashboard, you can know everything about this sample. It's all that we need about the sample. Greater Accra, where it is coming from.
This enables uniformity across Africa, creating a health corridor where people and goods can move freely. Over 9,000 people have died from the coronavirus in Africa. 186,000 patients recovered. In Ghana, the pilot country for PanaBIOS, COVID-19 related deaths stand at 95 people. Over 11,000 have recovered from the virus. Tracking the range of interactions is the heart of controlling the reach of the pandemic. It has been a hard journey. Hospitals and institutions are faced with a surge in corona cases. They have had to rely on technology to change how they fight against the virus, and accuracy is everything. The system monitors congestion to build a risk model so that if you test positive, the authorities can easily notify the most at-risk individuals, saving your friends and protecting your loved ones.
So we are very critical at this point when we are sorting. We want to be sure that whatever information that we have, if it's a name, is that the same name, or if it's a code, that is the same code on the sample. Now it's very, very critical to us. So far, the crux of the work is start from here. Because if you don't sort it well, if you mess up over here, then your results is also going to be messed up. And there have been some studies, I think you might be aware of it. It says that over 67% of laboratory errors actually happen here, pre-analytical phase.
Beyond local interactions, cross-border travel poses one of the higher dangers of spreading the pandemic.
At the screening point, they will take your temperature. After taking your temperature, you hand over the health declaration form and the yellow fever vaccination certificate to the officer. The temperature of it will record that if it's above a threshold around 38 degrees Celsius, then you have a quarantine, then we'll detain you there. Afterwards, then we'll check the vaccination certificates. That one has to also correspond with your name, your date of birth, your nationality, and your passport. Then, and the validity of the vaccination certificate. Then afterwards, if you have no any other problem, health condition, then we let you go through and go to immigration.
Many African governments have begun rolling out their economic comebacks, outlining guidelines for reopening of workplaces and learning institutions.
The world is a very small global village, so we depend on each other. So going forward, we've realized that as a country, we have to start easing. So somewhere beginning of June, the government took a decision to first do a strategic phase-out easing. So we started with a social gathering like the schools, churches, the rest.
PanaBIOS digitizes cross-border travel health clearance to suppress disease importation and transmission.
We have to reopen, and if you want to reopen, we know the whole world is going through easing of sanctions, and we have to get a system in place where we can have real-time data and also real-time oversight over whatever is happening along our borders and also at the airports. And I'm very sure that every country will be doing the same thing, because nobody will like importation of COVID-19 into the country again. First cases you've got are our imported cases. It started in China, it went to Europe, it went to North America, and now the epicenter is in South America. And if you are not very careful, with just complete easing without any checks, we will get another import into the country, and there will be upsurge of the COVID-19 in the country. And that's what I'm sure every country is doing. And the only way we can do this and do it efficiently and effectively is using technology.
The process is fluid. PanaBIOS is able to monitor and model the congestion, and in so doing can map how the disease spreads because of human congestion. Then we trace and alert people who may be infected and get them tested. As PanaBIOS is a virtual platform, we then allow people to access their test and vaccination results digitally, giving them certificates to allow cross-border travel.
What we have seen from PanaBIOS is an innovative way of making sure that at least you have a real-time data, you have a real time of following people and tracing them, contact tracing them to make sure they are tested if they are supposed to be positive for somebody, have become in contact with somebody. And with that, I think we can sit in our countries and know the people who are coming in and going out, what they are bringing, what they are taking out. And it's a way of also making sure that we get to know the disease better. We get to know the movement of people. This virus is all about mobility. So it moves people, people go to meet it. So once we open the economy, there will be a lot of mobility within the sub-region and the world. And that's the only way, the surest, fastest way of getting everybody to know where people are. And then we can then do whatever we do and do best.
Finally, it is back to business. Cargo and crew can move goods from industrial hubs to the markets. This is a vital push towards creating seamless trade opportunities, and more countries ratify the African Continental Free Trade Area Agreement. This project is powered jointly by the African Union and Pan-African institutions like African Economic Zones Organization, Afrochampions, Koldchain, and national government initiatives such as the Ghanaian government's Trancop program.